thank you again for this week, for the Community Circle conversations. This week, based upon some of our one-on-one conversations that I've had with individuals, there's been a lot of questions about funding for healthcare providers. So I've brought on one of my partners at NIMASTER, Eric Fisher, who's been the one most interested, I guess, engaged with our clients on these healthcare provider fundings. You're going to hear us refer to, and I'm sure Eric will shorten it for us, but the larger $175 billion fund, the Public Health and Social Services Emergency Fund. So Barb, you can go to the next slide. I want to be extremely brief for Eric. You've seen this from me over the past few weeks to talk about the different phases. Today, we're really going to focus on the CARES Act, which had $100 billion to this fund, and the Paycheck Protection Program and Healthcare Enhancement Act, which had $75 billion. Barb, you can move on. Here are the two appropriation authorizations. You can see that in total it's $250 billion, but $75 billion of that is purely for testing and response. And go to the next slide, Barb. The language that we see in the appropriations, it looks identical. This is the language from the CARES Act, and this is all we have to go off of, at least early on, to understand how this money will flow down. There are some buffers that we understand, and before we even got additional guidance, some people, some healthcare providers were receiving payments in early April that automatically jumped into your bank account, and you're probably saying, what do I do with this and how do I stay compliant? Well, Eric has the best information as of right now as to how those different funds will go, and hopefully we'll continue to stay up on this. I know that we'll continue to stay up with this and let you know about other abilities to access these funds. So Eric, take it away, and Barb, next slide. Thank you.
Okay, well, like Dustin said, there is a shorter name for the emergency fund. Folks are calling it the CARES Act Provider Relief Fund, which is still kind of long, but slightly shorter. So it's those appropriations that are intended for healthcare providers and healthcare organizations. There's sort of two different buckets of funds. One is the initial payments. Those were general disbursements, happened in two parts. The first part started on April 10th. That was allocated roughly $30 billion, and that was based on healthcare providers' 2019 Medicare billings. So providers received roughly 6.2% of their 2019 Medicare billings in their account sometime after April 10th through April 24th. As part of that process, you're required to attest that you can abide by the terms and conditions of the program, which is something we'll discuss in a little bit. And then there was a second payment as well. Obviously, some providers don't take a lot of Medicare payments, don't bill a lot of Medicare payments compared to their total billing. So there was a second payment that began April 24th, and that allocated another $20 billion. And that was based on 2018 total revenues. So some providers had already given that 2018 revenue information to CMS, and so those providers automatically receive payments starting April 24th. For those that have not provided that cost information to CMS, there is a portal on the CMS website where you can provide that cost information so that you can receive those payments. There is no requirement that these funds be paid back. It's not a loan. It's not like the Paycheck Protection Program where it's a forgivable loan. It is a grant, but there are, like you said, some conditions to acceptance of that grant. And then there are targeted initiatives as well. Those are smaller, but have a big impact on certain groups that are disproportionately affected. So the first one, it probably doesn't apply to a lot of the folks on this presentation, but $10 billion is allocated to hospitals highly impacted by COVID-19. Overwhelmingly, those hospitals are in the New York City metropolitan area, but I believe there are still some funds available. So in the event that there is another really significant outbreak, hospitals that are significantly affected in that could receive some additional funding. And then there's another $10 billion for rural hospitals and clinics. So that's something that's available for some of the healthcare providers in central Iowa and certainly throughout the state as they struggle with reductions in volumes and revenues associated with reductions in elective procedures and people making the decision to stay away from the doctor a little more than usual. And then there's a very small portion of the funds for additional providers, skilled nursing facilities, dentists, providers exclusively accepting Medicaid, and those are programs that CMS is reaching out to those that are eligible. So if they do reach out to you, that's something you would be eligible for. And we'll move on to the next slide for a discussion on reimbursements for uninsured patients. So some healthcare providers are treating a number of uninsured patients who have COVID-19 or COVID-19 related symptoms. The CARES Act Provider Relief Fund provides reimbursement for those providers treating uninsured patients at the Medicare rates, subject to the funding that is available. So on the slide, there's a list of what treatments are eligible for reimbursements. So in terms of coding and figuring out what sorts of treatment is going to be eligible for this reimbursement, that list is available. There's some additional information available on the CMS CARES Act Provider Relief Fund webpage. And so if you have very specific questions, that'd be a good reference. We're also happy to answer questions as well. And for that, providers became eligible to register for the program April 27th, and then claims are going to begin being accepted very soon. So that's something that I would recommend to the extent you've been treating those patients, registering relatively soon and being in a position to submit those requests for reimbursement as soon as you're able, because the funds are limited, and this might be a situation where they are gone sooner rather than later, as we've seen with a number of these relief packages. So being in a position to submit those reimbursement requests as soon as possible will put you in the best position to be reimbursed as much as possible. Moving on to the next slide for a discussion of the terms and conditions as well as best practices for complying with requirements. As I previously said, for the general disbursements, there are terms and conditions which apply. There are a set of terms and conditions for the Medicare distribution as well as the total revenue distribution. Those terms and conditions are materially the same, but there are some slight differences. You're required to accept both of those payments or attest to the terms and conditions within 30 days of receipt of payment or return the funds. So you have an option in the event you're not able to comply with the terms and conditions to return the funds. At the high level, some of the restrictions or requirements in those terms and conditions are, I think the most important one is that you're not allowed to seek collection of out-of-pocket payments for out-of-network patients that is greater than what the patient would have paid if they had been in-network, provided by an in-network provider. So there's a limit to that surprise billing. So you want to make sure that you're complying with that to the greatest extent possible. There are also a limit that the funds can only be used for certain items. One is preparation and treatment for COVID-19 related expenses that are not reimbursed by other sources. So the treatment of COVID-19 patients that's reimbursed by a third-party insurer doesn't fall into this bucket. But to the extent that the additional equipment is being purchased, there are structural changes to your healthcare facility, plexiglass in the waiting room, changes to how your actual facility. Those would be costs that would be allowed, as well as lost revenue. And so in terms of thinking about lost revenue, the way that we're thinking about it and advising clients is that you should prepare a return like you would to make a business interruption insurance claim. And that's most important for providers receiving in excess of $150,000 from this program, or in combination with other CARES Act programs. So if you get more than $150,000 from this program in combination with other CARES Act programs, largely the Paycheck Protection Program, there's going to be a report required on a quarterly basis. That's just something to keep in mind. And there's also limits on executive compensation. So in terms of sourcing those payments, you're going to want to make sure that the funds received are not going directly to pay folks in excess of, I believe it's $197,000. And given that there's other revenue coming into the organization, it's just a matter of sourcing that revenue as best as possible to show that those funds didn't go to highly compensated executives. There are also limits on lobbying as well as the use of these funds for MBAs. And then we'll move to some best practices. Some best practices would be to create a separate account to the extent possible for the use of the funds. That way it's going to be very easy to show how the funds were used. If you aren't currently providing services to cases of COVID-19, consider holding on to the funds, not spending them until additional guidance is received. We've gotten preliminary indications that that HHS is going to be looking at as all providers as treating COVID-19 patients as long as they're actually operating, because of the uncertainty about who actually has COVID-19. We need to make precautions.
And Eric, let me add, I think in that a lot of people get excited about this fund because I think there is a potential for just revenue lost to be recouped. But as Eric mentioned, we're still waiting on more guidance as to, we anticipate that will be the case, but certainly if you're treating people with COVID-19 right now, that's an easy sell. The just pure revenue loss is more of a challenge until we get more guidance. Is that fair?
Yeah, I think that's fair. The language around revenue loss is there, but that's a very general statement. And I think to the extent you can avoid actually spending the funds, even if it's past that 30-day period until we get that guidance, that would be the most prudent thing to do. Obviously, if you're in dire financial situation, I think you weigh the risks and make those decisions. But to the extent you can retain those funds until that guidance is available, that would be the prudent course of action. And the last best practice is generally just developing a system to track lost revenues as well as expenses to make sure when you're filing those reports that information will be available to provide to HHS. So moving on to the last slide, another program. This is the Medicare Accelerated and Advanced Payment Program. This is a separate program from the CARES Act Provider Relief Fund. So unlike the CARES Act Provider Relief Fund, this is a loan. So it's a short-term loan based on future Medicare billings. So some information is available on the slide. Eligibility, very easy to meet. As long as you're billing Medicare in the last 180 days, aren't in bankruptcy, not under investigation, and don't have any delinquent overpayments, you're going to be eligible. And so you can receive, based on the kind of provider you are, up to 125% of Medicare billings for 6 months, and then you're going to repay that over a period of time, again, depending on what kind of provider that you are. The application process is fairly straightforward, and so you can, if you have questions, contact your MAC. There is a hotline for each MAC on how to access the Medicare Accelerated and Advanced Payment Program. The application process, unlike many of these programs, is moving very quickly, sometimes as soon as 4 days.
Yeah, and just on the final slide, you'll see my contact information, and for any of you, just encourage you to reach out to United Way and schedule a one-on-one time if there's further information you need. So thank you for your time, and thanks, Eric.
Thanks, Eric and Dustin. Yeah, sorry, I didn't mean to rush it too much there, but great information. And those slides are available as well as the recording from Dustin's presentation and Eric's presentation this week will all be on our COVID-19 page. If we can go to the last slide as we wrap up our time today. So recordings on our COVID-19 resources resource page on the Community Foundation website. Those are all going to be available for you. We do have quite a good number of resources that we'll be sending out also in our follow-up email. So I hope you've been looking forward to those follow-up emails. We'll have additional resources. There is a checklist that Oasis, a HR company, had put out around welcoming people back and returning back to work. So we'll make sure that that checklist is available. And then we also had, I don't know if you guys saw in the Business Record Daily. If you don't get the Business Record Daily, it's a great twice a day kind of news buzz. But there was an opportunity in there for a Holmes Murphy webinar kind of on that topic. And so we'll send out the link about that. Christy had mentioned a survey as well. So we'll make sure that that gets to you all. And then for next week, really looking forward to welcoming AJ Mum, who's the Director of Polk County Emergency Management, to talk with our group. And the more questions that you can send in advance, to me to help AJ kind of focus in on our time together and make sure we're meeting your needs. I'll make sure to share that information with him, those specific questions. And obviously, anytime we're together, if you have a question you want to enter that into the chat box, you are more than welcome to do that. So thank you to all of our presenters, Tammy, Kurt, Amy, Andrew, Suzanne, for joining us today. We'll look forward to coming back same time and place next week. We will continue community circles through May, again, kind of that reemergence theme. And then after May, we'll kind of evaluate how often we'll get together, and we will continue to communicate opportunities to you. Oh, one additional thing I'll probably send out in the email. I don't know if those of you have seen Volunteer Iowa has announced there's a survey around COVID-19 AmeriCorps for the summer. And so those are free AmeriCorps positions. I don't believe there's a cost share associated with those. So think about if that's an opportunity for you, and I'll make sure that that goes out. I think the deadline is today to complete that survey. So visit our nonprofit COVID-19 resources page on our website. We'll see you next week. Have a great day. Thank you so much for being with us.